Welcome back, everybody. Today we're diving into something I think you'll find pretty interesting, especially given your, passion for public health. We're talking about the measles outbreak.
Okay.
That's happening right now in Texas.
Right.
So we're going to be looking at a recent CBS News article
Sounds good.
to get beyond just the headlines.
Yeah.
What's the real story here?
Okay.
What makes it relevant to you?
Right.
Even if you're not in the Lone Star State.
It's certainly a significant event.
Yeah.
Especially because this outbreak kind of shines a light on larger issues that we're seeing across the country.
Yeah, and the CBS article paints a pretty concerning picture. I mean, 48 cases.
Wow.
The worst outbreak Texas has seen.
Yeah.
In almost 30 years.
It's a long time.
And we're seeing hospitalizations, even concerns about it spreading to New Mexico.
Yes, it is.
Wow.
Quite serious.
Yeah.
And the severity of this outbreak is directly related to declining vaccination rates. Not just in Texas, but nationally.
Finally, yeah.
The article points out that 17% of parents are delaying or skipping recommended vaccines for their children.
Okay.
That's a substantial increase from just a couple of years ago.
Yeah.
When that figure was 10%?
That's striking to me because this is happening despite the measles vaccine being incredibly effective.
Yes.
The article mentions that it's 97% effective.
That's right.
With 2 doses.
Yeah.
So that begs the question, why are we seeing this hesitancy towards vaccines even when the science is so clearly in their favor?
That's a complex issue with a variety of contributing factors. Misinformation circulating online. Certain cultural beliefs and even historical events have all played a role in shaping public perception of vaccines. It's important to approach these concerns with empathy and accurate information.
Okay, speaking of the virus itself.
Yeah.
One thing that really caught my attention in the article was just how contagious measles is.
It really is exceptionally contagious. One of the most contagious viruses.
Wow. So instead of just picturing like one person walking into a room.
Yeah.
Can you explain the concept of R naught and how it applies to measles?
Oh, of course.
It would help us understand the spread in more concrete terms.
R naught or R0 essentially tells us how many people, on average, one infected person will transmit the virus to in a susceptible population. For measles, the R0 is estimated to be between 12 and 18.
Wow.
This means that without any immunity, one person with measles could potentially infect 12 to 18 other individuals.
That's a lot of people.
It is. This highlights why maintaining a high level of vaccination is crucial for what we call community immunity.
So community immunity.
Or herd immunity.
Or herd immunity. Okay. Protects even those who can't be vaccinated, right?
Exactly.
Could you elaborate on that for our listener?
If enough people in a community are immune to a disease, it becomes much harder for the virus to spread. This indirectly protects vulnerable individuals who might not be able to receive vaccines, such as infants, or those with compromised immune systems. For measles, that threshold for community immunity is around 95%.
Wow.
Vaccination coverage.
And this outbreak, as the article points out, originated in a Mennonite community known for its low vaccination rates.
That's right.
I imagine this presents a real challenge for public health officials.
Reaching communities with deeply held beliefs that may differ from mainstream medical recommendations, requires sensitivity and a nuanced approach. Public health messaging needs to be tailored and delivered in a way that respects those beliefs while emphasizing the importance of protecting the community as a whole.
This situation really underscores the tension between individual choice and the well-being of the entire community when it comes to vaccinations.
It does. It truly highlights the complexities involved. This situation reminds us that the measles vaccine has dramatically changed the landscape of public health.
Absolutely. The article mentions that before the widespread use of the vaccine, measles was a major killer.
It was
claiming hundreds of lives annually, mainly children.
Yes, the pre-vaccine era saw an estimated 400 to 500 deaths each year.
Wow.
In the U.S. alone.
That's a lot.
A truly heartbreaking statistic.
Yeah.
The introduction of the vaccine has been a remarkable success story, dramatically reducing the number of cases and deaths.
Okay, so we know the measles vaccine is highly effective.
Yes.
And has saved countless lives.
Yeah.
But what about the experience of actually having measles?
Right.
The article lists some symptoms, but I'm curious to know what it really feels like.
Yeah.
Beyond just a clinical description.
Well, think back to the worst cold or flu you've ever had, and then multiply that misery tenfold.
Oh, wow.
Measles is far more severe than most people realize.
Right.
It's not just a simple childhood illness.
I remember reading about these tiny white spots that appear inside the mouth.
Right.
A rather unique symptom.
Yes.
And then there's that distinctive rash.
The Koplik spots.
Okay.
These tiny white spots in the mouth.
Yeah.
Are indeed a classic sign of measles. They usually appear a couple of days before the rash.
Okay.
And as for the rash itself, it's quite striking. It starts as flat red spots, often on the face, and then spreads downwards, eventually covering the entire body.
Oh, wow.
It can be quite itchy and uncomfortable.
And along with rash and high fever, the article mentioned a cough, runny nose, and red watery eyes.
Yep.
Sounds truly miserable.
It is.
But it's not just the initial symptoms that are concerning.
That's right.
Yeah.
Measles can lead to a whole host of serious complications, especially in those who are unvaccinated or have weakened immune systems.
The article highlighted pneumonia as a common and potentially dangerous complication.
Right.
Particularly for children.
1 in 20 children with measles will develop pneumonia, serious lung infection.
Right.
That can be life-threatening. And it's not just pneumonia, encephalitis, which is swelling of the brain, is another rare but very serious complication. It can lead to permanent brain damage.
Wow.
Deafness, or even death.
The statistics are pretty stark.
They are.
The article mentioned that 1 in 5 unvaccinated people will be hospitalized due to measles complications.
That's right.
And 1 in 1,000 will develop encephalitis.
It's a sobering reality check.
Yeah.
Measles isn't just a mild rash and fever. It can have lasting and devastating consequences.
And even in cases where people recover from measles, there can still be long-term impacts, right?
Yes. There's a phenomenon called immune amnesia, which researchers are learning more about.
Right.
Measles can essentially weaken the immune system for years.
Oh, wow.
Making individuals more susceptible to other infections.
Right.
It's like hitting the reset button on your immune system's memory.
That's a fascinating and concerning detail.
It is.
I hadn't heard about before.
Yeah.
It really adds another layer of complexity to this disease.
It certainly adds a new dimension to our understanding of measles and the importance of preventing it.
This has been incredibly insightful. But, I want to bring this back to our listener.
Sure.
What are the key takeaways for someone who may be listening to this outside of Texas?
I think this outbreak, regardless of location, serves as a stark reminder that infectious diseases are a global concern. What affects one community can easily spread to others, especially with the ease of modern travel.
We often think of measles as a disease of the past.
Yeah.
But this outbreak shows that it's still very much a present threat.
Exactly. And it underscores the need for continued vigilance when it comes to vaccination. Maintaining high vaccination rates is essential, not just for individual protection, but for the health and safety of our communities as a whole.
So knowing your interest in public health, this outbreak really highlights how important accurate information and community engagement are. What advice would you give someone who wants to advocate for better public health measures in their own community?
I think one of the most powerful things we can do is engage in open and respectful conversations with friends, family, and even within our broader social networks. Sharing accurate and reliable information from trusted sources, the CDC or the World Health Organization, can help dispel myths and misconceptions about vaccines.
Instead of shying away from these conversations, we should equip ourselves with the knowledge to address concerns and advocate for evidence-based decision-making when it comes to health.
Absolutely. We can also support policies that promote public health, like strong vaccination requirements for schools and childcare centers. And these policies have been proven effective in preventing outbreaks and protecting vulnerable populations.
This has been a truly eye-opening deep dive into the measles outbreak and its broader implication.
It really has.
Thank you so much for sharing your expertise with us.
It's been my pleasure.
The more we understand about infectious diseases and the importance of prevention, the better equipped we are to create healthier communities.
Absolutely.
For everyone.
I agree.
For our listeners, I encourage you to check out the resources mentioned in the show notes to learn more.
Sure.
Remember, staying informed and engaged is one of the best ways to protect yourself and your loved ones.
Absolutely.
Until next time, stay curious,